What are some of the most common symptoms that are associated with gallstones?
Usually patients complain of abdominal pain in the upper abdomen. They'll get bloating, they'll get food intolerance, they'll get nausea, vomiting, all sorts of GI symptoms basically.
But here's the thing, they sound very generic in terms of other diseases or other infections that might have the same symptoms. So how do you diagnose, how do you know it's gallstones?
Well, you know, the physician needs to do a very thorough exam. This is where the art in medicine kind of shines, and you know, you have to have a careful ear, really listen to the patient, examine them, and then order the appropriate tests depending on what you're thinking the patient may have.
But sometimes there's no symptoms, and that's
True.
tricky.
That's definitely true. You can have asymptomatic gallstones.
Okay. And how would a person know they even have it then?
Sometimes these are found incidentally. Patient will go in for another separate problem, and then when they do imaging studies for something else, they'll come up with the gallstones, but the patients won't have symptoms.
So if they have no symptoms and they're really not feeling the effects of the gallbladder, do they still need to be treated?
Not necessarily.
Okay.
I think that most patients who have gallstones without symptoms are observed. It's about 80% of patients with gallstones without symptoms won't have any. Now, the risk does go up year by year, 1 to 2%. So,
Okay.
you know, they need to be aware that they have gallstones and they, at some point, will get some symptoms.